Cancer Awareness Month. Thanks so much for joining us. And I'm joined this morning by Dr. Nina Ferreras from GBMC to talk about some of the issues with this really important topic. Dr. Ferreras, thanks so much for doing this morning.
Morning. Thank you for having me.
Yeah, and it's just one of those cancers that is, I feel like even still in 2021, more common than most people either know or at least care to think about.
Yeah, it is. It is the third most common cancer for both men and women, and the second most common cause of cancer death. So it is definitely significant, and we have some great screening tools available. So definitely something to keep on the radar as preventative care.
So the gold standard in preventing and diagnosing colon cancer is the colonoscopy, and people have heard about it. There's a lot of people, even over the age of 50, who've never gotten one. What do you tell people, your patients initially when they come, who may have some concerns? In my opinion, I feel like it's a lot of times they don't know much about the test, and what they have heard, they don't want to hear about it. So you kind of have to get past that hurdle. But I feel like once you do, people could be pretty reasonably convinced to get this test.
Yeah, so it is definitely our gold standard test. And I always stress it's a really nice opportunity. It's one of the unique circumstances where we actually have the ability to remove abnormal tissue before it becomes cancer. It's a pretty impressive preventative tool. Yes, you have to clean out your colon, but you're asleep for the procedure. You get the day off from work and you'll feel fine the next day. I tell everybody to schedule a nice meal after their test. It's really pretty painless. Most patients, when they do finally go through it, say it's really not that big a deal. There are other alternatives out there. And for my patients who have gone through them, they actually think they're less comfortable. So a virtual colonoscopy is something I get asked about a lot. You're awake for that one and you still have to clean out your colon. And it doesn't have the advantage of being able to remove polyps. So I still really recommend the colonoscopy as the gold standard test.
Dr. Ferris, I'm so curious about this too. You must have trained to do that test, and you're, unlike an operation or when you're giving someone stitches on their skin, you can't see exactly, you're looking through a camera, I imagine, and controlling it. And as you say, potentially even removing polyps. It sounds very difficult, but I assume you've done a lot of these and you make it look easy.
Yeah, it's a very straightforward procedure. And it's usually pretty quick. They are usually about a half an hour, maybe 45 minutes if there are some things that need to be removed. And like I said, very powerful. We can actually remove tissue before it becomes concerning or before it gets to the cancer stage.
Over the past year, just here in our area, we had Trey Mancini diagnosed and very publicly with colon cancer. I just saw him playing in a spring training game yesterday. He hit a home run down in Florida. He looks great. It did not go so well for Chadwick Boseman, the actor, who apparently was diagnosed a little bit after the cancer had progressed a little more. But these are very young men who were diagnosed with colon cancer. Is that something that's increasing, or how rare is that?
It does seem to be increasing our diagnosis in younger folks, and we're not 100% sure why that's happening. Part of it may be screening, but that doesn't seem to account for all of those diagnoses. Everybody always talks about family history. About 20% of patients with colon cancer will have a family history, but only 5 to 10% of those are like a known genetic mutation that can be tested for. If you have a family history, it's something you should know. And certainly if you have any concerning symptoms, even if you're young, don't brush them off as hemorrhoids. If you have blood in your stool, if you're having change in your bowel habits, if you're having, abdominal pain, weight loss that's not explained, anything like that, any symptom that seems a little off, please go into your doctor. It's worth getting worked up. And as I said, the colonoscopy is really not that big a deal. So better to have it known than unknown. The differences in survival are definitely great. If we can catch it at an earlier stage, the survival benefit is significantly increased. And so, the earlier we're catching these things, the better.
Doctor, we've talked about this before, but I've actually had 2 colonoscopies in my life already with the family history and all that stuff. And I'm 47, so I'll be getting another one here pretty soon. And I'm wondering if that's become more common. I know there has been either a change in the recommendation. I don't know how you'd phrase it, where it used to be 50. Everybody knows it was always 50 years old. Now I believe the recommendation is 45 years old to start getting these.
Yeah.
What's the latest on that?
Absolutely. The American Cancer Society changed their recommendation to age 45 for all patients of average risk for screening. That's patients without a family history, without symptoms, without anything other than just routine preventative care. So they dropped that in 2018, spring of 2018, down to age 45. A lot of people are still catching up with that change in recommendation. But again, we're more than happy to see you, even if you're not having symptoms. It's such a powerful thing to be able to remove this tissue before it becomes a problem.
Okay, I'm going to ask you the hardest question of the morning, and it's okay if you don't feel comfortable answering this one, okay? But I'm going out on a limb with you. So now that the recommendation is down to 45, there is still a cost associated with getting a colonoscopy. It's not free. So the question is, are insurance companies keeping up with that recommendation of a change? In other words, if I'm 46 years old and I need to get a colonoscopy, is my insurance company going to help me out with that? Or is that something that needs to be kind of cleared up before you go in for the procedure?
We always encourage patients to check in with their insurance company before they schedule the procedure to double check and be sure, but most insurance companies do seem to be complying with the new recommendations.
I think it does help that that change was made even by the American Cancer Society. It's not something where you can say, oh, this is an extraneous test. I mean, they're saying people are getting this disease at a younger age than apparently we used to.
Absolutely. Yeah, it does seem that way. And so again, any abnormal symptoms at all definitely merits screening as part of your usual routine preventative care.
And
Yeah.
can you just talk a little bit about too, not necessarily the cost, which is obviously exponentially greater, but I just can imagine the damage that can be done by actual colon cancer over a period of waiting to not get a test versus just going ahead and getting the test early, getting rid of a polyp. It can be almost insignificant compared to actually dealing with colon cancer for you and for your insurance company at a later date.
Yeah, interestingly, colon polyps do change relatively slowly, actually, over time, which is why if we find polyps, typically we will recommend a colonoscopy every 5 years. Otherwise, it is every 10 if your first colonoscopy is clean and you don't have any other risk factors or changes in your health status. So those things do change slowly over time, and there are often not a lot of symptoms associated with polyps. Until you get to the cancer stages, that's when you start to see the symptoms. And yes, the longer you let it go, certainly survival goes down. We have great options. We have minimally invasive surgical options for colon cancer, rectal cancer. There are some very good protocols for neoadjuvant chemotherapy and radiation that really help improve survival rates and improve surgical outcomes. But definitely the earlier we catch these things, the better your outcome is likely to be.
I've heard about, and people may have seen on TV, there's ads now for these tests that you have to do something at home and manage to procure a sample of that and send it off somewhere. What's your view on those, given the work that you do at the hospital?
Again, the Cologuard testing or the fecal DNA testing that is available these days is better than nothing, certainly. If you are not going to come in for your colonoscopy, please consider this testing. It is better than the occult blood testing that we used to rely on. It has a pretty good sensitivity and specificity for detecting colon cancer. It's less good at smaller polyps and less advanced polyps. But still, again, better than nothing. If the testing is positive for concerning changes, the recommendation is going to be that you come in for that colonoscopy so we can remove that tissue or biopsy it, which is not something that can be accomplished with that at-home test. It does not have that advantage of being able to remove what's abnormal before it turns into cancer. You got to come in for the colonoscopy for that part.
I want to ask you about the prep, because that is something that a lot of people do get concerned about. You just have to schedule it with your work or with whatever responsibilities that you have, because it is going to take away some time from the day previous to the colonoscopy. But has that changed over recent times? Has that gotten a little better or different in any way than it was years ago?
Absolutely. The preps have changed fairly significantly. We now do what we call split dose prep, which means you do part of it the night before and part of it rather early in the morning, the day before the day of your procedure. It gives us a better clean out. It improves our polyp detection rates, makes it a better test for the patient. And it is now smaller amounts of the actual prep liquid. I've been told they don't even taste half bad at this point. It is still a lot of liquid that you need to drink prior to the procedure, but most of our patients are doing very well with it. One company actually just came out with another tablet prep, which they had taken off the market for a while, but patients do like if they tolerate tablets. You just got to make sure that you drink plenty of whatever your favorite clear liquid is with that prep to get everything cleaned out.
And it makes sense. You want a good look at everything
Exactly.
once you get in and do the colonoscopy. And I got to say this too, Dr. Ferreras, thanks for doing this again today. But I've talked about this with other friends of mine who've had a colonoscopy, and some people kind of agree with me, and some people think I'm crazy, which may be the case anyway. I understand that. But after I've had the colonoscopy, and I'm not someone who goes through, people have these cleanses and they do these things. I don't really know about that. I don't do those. I will say the day after I had the colonoscopy, having gone through that prep, oh my gosh, I feel like $1,000,000 coming out of there. And I'm just wondering if it has something to do with the prep that I went through the previous day. It's incredible how good I feel coming out of that colonoscopy.
I have not heard that very often, but that's great. Maybe it's because you're doing a good job taking care of yourself and doing all the things that you're supposed to be keeping up with.
That's right. That's fine. I think that's a side benefit. I'm wondering,
Self-care.
yeah, self-care is a good thing. When people talk about their symptoms, it seems like it's 2021 right now. I hope people are past the fact they feel maybe a little uncomfortable talking about some of these things, because these are very important health issues that need to be addressed. And I just feel like sometimes maybe people get a little embarrassed and they don't want to talk about it, but it's important. What are some of the symptoms that people should be watching out for, and that may concern them, may want to have them call their doctor if they're seeing something like that?
Yeah, it can be a sort of private subject, but again, this is what I deal with all day, every day. You're not going to say anything that surprises me. Really anybody who's having any kind of rectal pain, anal pain, bleeding, swelling, any changes in your bowel habits or things that you've noticed that are just different from what they used to be. All of those things are things that are worth talking to your doctor about, and maybe even coming to see a specialist for. Our exam is a little bit better in our office than in some of the other doctors' offices. And so, we're able to get to the bottom of whatever is going on and hopefully help with that problem to make it better, so that you're not suffering with something that you're afraid to talk to someone about. Abdominal pain, bloating, or recent unexpected weight loss or other things, they're a little less common, but certainly, again, need to be evaluated.
Yeah, it's tragic that people would put themselves through that, in some cases, weeks or months, often there's an actual issue that can be dealt with and fixed in short order.
Yeah, absolutely. And that's what we're here for. I mean, there's no reason to suffer with discomfort or with something that you're wondering if it should be checked out or not. Just come on in and get it over with. Yeah.
The pandemic, doctor, forced all kinds of changes, especially maybe right back a year ago, back at the beginning. There was even some procedures that were delayed or put off by the state, and there was different regulations that went on. What's the situation at the hospital now? And if people have an appointment, what's the procedure for coming in and taking care of that?
Absolutely. The recommendations do seem to change fairly frequently as the of overall climate changes within the pandemic itself. Currently, we are back to capacity, trying to catch up with the colonoscopies that were put off earlier in the year, or really throughout the whole last year. Patients are currently being asked to get a COVID test prior to their procedure, even if they've been vaccinated, just to be 100% sure that everybody in the hospital and all of the staff are being protected, as well as our other patients. And a lot of precautions are being taken. Masks are being worn for, as much of the time as is reasonable and possible. And at this point, I feel like it really is safe to come on in and get your preventative care taken care of, so that we are not putting things off and landing you in the hospital with a more serious problem down the line. We'd rather see you come in and get it checked out. So.
And it's important to point out too, doctor, this is men and women get this, and it can be deadly for both. Talk a little bit about younger men and women too, because we talked about the Chadwick Boseman case and the Trey Mancini case, and there's been others. But what if you're a younger person feeling those symptoms? I mean, at what point do you think, hey, I'm only 25 years old, I shouldn't have to be dealing with this? Like, what are your recommendations for someone of that age who might have concerns going forward? Can they feel comfortable coming to get checked as well?
Yeah, absolutely. Any age, really, if you're experiencing any of those symptoms, a lot of times there's a diagnosis that we can help with. There are a lot of anal diagnoses that can cause bleeding, such as hemorrhoids or anal fissures. And those are things that we can help with, help treat, help improve your symptoms, and get you in for that colonoscopy and screening if that's what needs to be done. A lot of times ruling out that there's anything more serious going on is step one. And it helps put the patient at ease too, that we're dealing with something that's not as serious as they might be concerned it could potentially be. So even younger patients should absolutely come on in if they're having symptoms or changes. Like I said earlier, we're not really sure why we're seeing it more in younger folks at this point in time. It's something that's still being studied and worked out, but there's no doubt that we certainly are. And so we want to make sure that we're treating everybody regardless of age.
I'm wondering if you think, and without all the studies finished, it's difficult to say, but I'm wondering if people think, or doctors think, it has something to do with nutrition, and if that's true, or even if it's not, what are the current recommendations as far as, keeping your system healthy and preventing colon cancer just by having a healthy living lifestyle?
Sure, absolutely. And you just said it, actually. It really does come down to a lot of the same recommendations that we make for an overall healthy lifestyle. You want to maintain a good active lifestyle, at least 30 minutes of activity daily if possible. You want to maintain a nice high fiber diet. Most of us are not getting enough fiber in our diet. I like to tell my patients, I think everybody should be on a daily fiber supplement, a tablespoon of something mixed into water. You want to stay well hydrated, aim for 64 ounces in a day, avoid smoking, avoid excessive alcohol intake. Excess weight can certainly contribute. As far as diet goes, there are not a lot of very specific. There was one study that came out a few years ago that implicates processed meats, like sausages and lunch meats and that sort of thing. So you just want to limit your dietary intake of anything that might be overly processed. But again, basically the same recommendations that we make for any healthy lifestyle.
Okay, Dr. Nina Ferreras, again, thanks so much for doing this. Just give you one more chance to go over the recommendation for everybody who's watching today. I don't think people maybe should be concerned about colon cancer. They should feel worried about it, or is it just part of their normal operating procedure as they see their doctor? It's something to think about, especially now. And if there is some concerns, it's okay to talk about it and get it fixed as soon as possible.
Absolutely. It's something that if you're noticing anything, you should say something and come in and get it checked out. It should be as routine as getting scheduled for your mammogram or your prostate exam. It should be just as routine as that. At age 45, everybody should be considered eligible. Some patients are eligible earlier based on family history and that sort of thing, or other risk factors. And certainly if you're having any symptoms, come on in and let's get you checked out. We'll give you the peace of mind of knowing that it's maybe not the worst thing that you could be worried about.
Okay, Dr. Nina Ferreras from GBMC. Thanks again so much for doing that this morning, and we'll talk to you again soon.
Absolutely. Thanks for having me.
Okay, I think we're going to wrap it up there. Thanks very much.
We're off.